Other things to consider. After you have your baby, I want you to think about the only job that you should have is to rest, to eat, to drink, and to breastfeed. Nothing else. I know that for some people that is not not entirely possible, but get as close to that as you can. If you have to pull in some favors from your neighbors, from your family members, from your friends, try to organize things so that you will be able to pretty much just rest and eat and breastfeed. This is how you will do the best emotionally, physically, and mentally, and this is how your baby will do the best in all of those ways, including one more, intellectually. There are so many benefits to breastfeeding, and for those of you who are not planning on breastfeeding, I'm not here to try to make you feel bad or convince you, but for those of you who are planning to breastfeed, I want to just share with you some of the really great benefits that breastfeeding will have for you as well as for the baby. If you think about the concept of vaccinations, these are things that are put in from the outside in order to give the body some immunity to certain known diseases. But the best immunity that you can have, bar none, better immunity than through vaccinations or through anything else, are the what we call the natural inoculations that your baby is going to have. And the natural inoculations happen like this. The first one will happen when your baby comes through the birth canal and the fluids that you have in your vaginal canal literally smear themselves onto your baby's body, causing all of the antibodies that your body has ever made in your entire life to base the baby, so that your baby now has those antibodies to the same things that you've developed them for. The second time that your baby is going to have a natural inoculation is when you put your baby on your skin to breastfeed. And as soon as your skin touches the baby's skin, and with the father, same thing, as soon as the baby's skin touches the father's skin, all of the natural antibodies that your skin has are also being passed on to the baby. The third time is when the baby starts to drink the free milk fluid called colostrum that's in your breasts when the baby is born. You're not going to have milk immediately. It takes a couple of days for the milk to come, but all of the fluid that your baby is going to be nursing on is pure immunity that you're going to give this baby. Then when the milk comes, that's the fourth time that your baby is going to have a natural inoculation. And then there's still one more that we didn't know about for a long time, but that it has been discovered, and it's called nursing backwash. And it is the most miraculous thing that you will ever hear about. When your baby puts his or her mouth on your breast, your body is going to suck a little bit of the baby's saliva, and it will analyze, like a laboratory. It will analyze what viruses and what bacteria your baby has been exposed to, and it will create antibodies to those things, and it will put them into the milk, and your baby is going to drink that from the backwash procedure. Now, if you are not able to do one or some of those things, hopefully you will still be able to do some of the others, so that you can get as much of that natural immunity into your baby's body. I just think this is one of the most remarkable things on earth. The longer that you nurse, the better for the baby and the better for you. Moms have tremendous amount of benefits for breastfeeding, including less risk of gynecological cancers, breast cancer, diabetes, heart disease. There is so many benefits to you. For the baby, not only the things we just talked about, but also they already know that cognitively, babies, children that have been breastfed do a lot better. And so the future health of the baby also is hugely improved by breastfeeding. The chances of diabetes and obesity, all of those are decreased when you breastfeed. Sometimes breastfeeding comes with some issues, and mastitis is one of those issues. Mastitis is literally where there is an actual clog in the milk ducts, and the milk starts to get backed up, and it becomes very painful, and it can actually become infected. So we have the perfect solution to mastitis. When you catch it early enough, what you do is you go into your bathtub, you fill it up with hot water, and you get on your hands and knees, hopefully with your breasts dangling. And what happens is that the heat of the water, as well as a little bit of pressure, a little bit of massage, will actually allow that clog to dissolve and to leave, and then the milk will start flowing. And then you get your baby to nurse right away. And then if it doesn't completely clear it up, you do it again 3 or 4 hours later, and you just do it a few times until everything is completely done. If you catch this early on, very early on, you will not have to take antibiotics and all the other things that sometimes have to happen with mastitis. So I put adjustments here for mastitis, as well as adjustments for fevers, colds, respiratory infections. But this is because your immune system is directed by your nervous system. And if you are subluxated, your nervous system is not functioning properly, which means that it is not properly directing the rest of the systems, including the immune system, into what it's supposed to do. So getting adjustments when you're sick in any way is something that is extremely helpful. When your babies get sick as well, they have a fever, if they have colds or respiratory infections, adjustments are really great for that. In fact, one of the most common reasons for children to come into our office is ear infections. When do you start feeding your babies solid food? And this is a controversial question, but nature shows us when our babies are ready for solids. You know how we know? Because they have teeth. A baby that doesn't have teeth should not be eating solids, even if it's blended in your in the greatest blending machine that makes it all like puree. The reason why that is not a good idea is because when you start to develop teeth, when the teeth start to come in, that means that the digestive system has the enzymes that are necessary to digest solid food. Even if it's pureed, it still needs to have enzymes that are going to break it down. And so the best indication to know when your baby is ready for solids is when you see the appearance of teeth. The safety of ultrasounds has not really been proven yet. And I feel sometimes that ultrasounds are abused. These 3D ultrasounds, color ultrasounds that people are doing just to see their babies before they're born. Please be careful with ultrasounds. If you have to have them for a medical reason, that's a whole different story. But just to have ultrasounds for fun, it isn't totally proven that ultrasounds are 100% safe for the babies. If you have trouble breastfeeding, there is something called baby-led nursing, and it is the concept that mammals in nature never need any help in order to find the nipple and to start nursing. And human babies are the only ones that we feel like we have to position them in just a certain way, and we have to hold them in just a certain way, and we even have names for the football hold and the normal hold. And if you look at a puppy, a bunch of puppies that are just born, the mom just lies there, and the puppies find the breasts, they find the nipples, and they nurse fine. If you put a human baby on your belly, if you're lying down on your back, and you put the baby, a newborn, on your belly, and you don't do a thing other than preventing from falling over, you just kind of hold your hands around the baby's body in order to keep them from falling over or from rolling off of you, that baby will do what a puppy will do. That baby will literally army crawl all the way up until they find your nipple, and they will attach themselves. Sometimes they will come up exactly vertical up onto the nipple. Sometimes they will find their way horizontally or obliquely onto your nipple, and they will latch. And that will be the most perfect latch that your baby can have. Better than the football hold, better than any hold you can do. They will find the best position. So start with, you know, the normal positions, but if you have trouble, please Google baby-led nursing. Go on YouTube and find some videos. Go on our website. We have a video of a newborn finding the nipple and doing what I just explained. And try doing that and making sure that the baby can find the nipple on their own. And this is the best latch that you can ever get. The last thing I have here is about swaddling. And we know that swaddling is a really comforting position for babies. They love to be contained because it reminds them of when they were in the womb. And we swaddle them when we want them to go to sleep so that they don't fling an arm and wake themselves up. But there is a proper way and a not proper way to swaddle a baby. And if you go to the website for the Hip Dysplasia Institute, you will be able to see a video there that shows you the proper and the improper swaddling. And I have their website ID here, I'm sorry, their address here. It literally, I think it's just hipdysplasia.org, yes. And in there, you'll be able to find that video that I'm talking about. But basically, what the video is going to show you is that a baby needs to be swaddled in such a way that their legs are able to stay open like this, not straight, like you see here, like you see on the green swaddle. All of these are perfect ways to swaddle, so the baby is tight at the top, but the legs are froggy style, able to be completely open like that. And the reason for that is because when babies are born, their hip joint right here, which is the junction between the leg bone called the femur and the hip bone right here, it makes this perfect ball and socket joint. As long as the baby's legs are froggy style, it fits perfectly like this. But you will see in the video that as you straighten this baby's legs, the head of the femur actually pops out of this socket, and it either pops completely out or it pops partially out. So you don't ever want that to happen to your baby. They don't have the ligaments or the muscle structure yet to hold the position of the femur head as the legs get straightened out. So that's something to be really careful about. Okay, how to diaper properly. One thing that I see a lot is that parents think they have to lift their babies up too much in order to pull their diaper out and to bring the new diaper in. And the truth is that when you do that, you are bending these babies' spines right in the mid part of their spine. And those nerves that come from the mid part of the spine go to their gastrointestinal system. A lot of babies that have reflux and that have colic and different GI problems may be due to subluxations in that mid part of the spine, that you might be causing by lifting them too high and bending them in that part of their spine. So you only need to lift them up this much. The amount of space to pull a diaper out or to bring a new diaper in is all you need to do. So you lift them up, not too high, and you want to bring both legs together. You don't want to lift just one leg, which I have seen parents do. One leg and the other one is kind of, the hip is very misaligned in that situation. Also, you never want to twist their hips in any way. One, by either lifting a leg, one leg instead of both legs, or by pressing into the diaper tape and pressing right into their hip. There is absolutely no need to press into the baby's hip. You can put your fingers inside of the diaper and then press the tape against your own fingers rather than against the baby's hip. If the baby has made a mess, and sometimes they do, and the mess goes all the way up to their, almost to their neck, don't lift the baby up to be able to clean all of that. What you do is you turn them on their side and then you clean them up like that, or you bring them to the bathtub or to the sink and you clean them like that. How to properly wear your baby? The answer to this question is very simple. If you think about how you would be holding your baby in your arms at the age they're in, that's how you would want your baby to be in a carrier. So, for example, this baby that is very, very new, you would probably have him or her in your arms lying down sideways so that your forearms are actually where they're resting on. So you want a carrier that will mimic that same position. However, this baby here that is able to sit on his own will do really well on this kind of carrier where he is in a sitting position. You would never put this newborn baby in a carrier that looks like this because they're not able to sit up. They haven't earned their right to sit up yet. And so you would never put them in a sitting position. So just ask yourself, how would I be holding my baby right now? And get a wrap or a carrier that will keep them in that same position. What I do want you to really pay attention to are these two positions that we see here, these two babies, and the difference of how this baby is literally hanging by the crotch, whereas this baby is sitting on his sit bones. You never want to have a baby hanging by the crotch like this. You want them sitting in their sit bones like that. And then here's advice for moms. And I don't really like this because this is very hard on the spine. But if you were to hold a car seat with a baby in it, you would want this car seat to be as close to your center of gravity as possible. You do not want to hold the car seat on your forearm. You don't want to hold it on your hand. You don't want to walk around with a car seat hanging anywhere other than hopefully in as close to your center of gravity as possible, either by hanging or by putting both arms underneath the car seat. But we talked about how we don't really want babies in this car seat. So there is no reason for you to be holding a car seat. When you come to your appointments here after your baby is born, bring your baby in your arms. We have pillows. The pregnancy pillows are also baby pillows. We can put the baby in the pregnancy pillows and they can just sit there while you get adjusted. We have a changing table with a mattress where the baby can be strapped in and be okay. So better to not carry your baby in the car seat. You carry them on a stroller that's flat, right? Or on your arms. A very common thing that happens to moms after they have babies is that they develop something called new mommy's neck. And it is actually called new mommy's syndrome. And it is related to the position that you're going to put your head in when you are feeding your baby, when you're holding your baby, when you're bathing your baby, all of these positions are causing you to constantly be in a hunched over, looking down kind of position. And if you can think about doing this for 30 to 60 minutes at a time, 7 to 10 or 12 times a day, you start to get an idea of how this occurs. So what you want to do is to really think about proper positioning of your body. You really want to be able to just lie back onto a surface that has good support with pillows. You want to have pillows under your arms so that the baby is actually on your arm, but supported by a pillow underneath your arm, not in midair. And this is how many of you will be able to avoid having new mommy's neck, or at least to minimize some of the effect. That's why we adjust you in the 3 months period after the birth of the baby, so that we can help you with all of these things that happen during that time. So looking down while nursing, hunching over while bathing, or changing the baby, these are all the reasons that you can develop that. Okay, so I see a smiley face, but Jamie, I think that's your picture. I am ready to answer questions. Feel free to ask any questions that you may have, either by speaking or by putting them on the chat, or if you want to just talk about these things on your next visit, that will be fine too. Does anybody have any questions or any comments about anything that we just talked about? Nobody? Okay, very good. So thank you very much for being here. I hope that this was helpful and that you guys will take some of these things to heart and apply them and teach them to other moms that you might meet along the way. These workshops are always open to the public. So if you want to invite anybody to the pregnancy workshop or to the new baby workshop, I would love to have them here. I want this information to be out for everybody to hear. Good night, everybody.
Thank you so much.
Who was that?
Jamie.
You're welcome, Jamie.
Have a good night.
Thanks so much.
You're welcome.